Hello, my name is Bryan Grijalba, and today I'm going to be talking about chronic traumatic encephalopathy and its prevalence in professional athletes. Before we dive into the matter, I wanted to share why I picked this topic and why it's important to me. This is me at 7 years old, where for the first time in my life, I would put on a pair of gloves and discover one of my passions, fighting. And over the years, I would go on to participate in countless tournaments, training camps, and sparring sessions in karate, kickboxing, as well as mixed martial arts. And while I had many great experiences, there were consequences. Here on the right is me, and on the left is professional UFC fighter Rafael Alves, and at the beginning of our sparring session. As you probably would have guessed, this didn't end well for me. And like this, there were countless moments of defeat, struggle, and pain. It was not uncommon for me to return home after a training session and feel a headache or a migraine. Deep down, I knew it was a consequence of the sport and that getting hit in the head was affecting me. I always wondered what was happening to me. Was this dangerous? Was a sport I loved and passionate about detrimental to my health? In search of answers, I decided to do some research and came across CTE. So, what is CTE? CTE stands for chronic traumatic encephalopathy. Chronic meaning it builds up over a long period of time. Traumatic because research has shown that there's a pretty good connection between repetitive brain trauma and developing these findings, which we'll get to that later in the presentation, and encephalopathy because of the general disturbance in the function of the brain that it causes. CTE was first described in 1928 when Dr. Harrison Martland described a group of boxers as having punch drunk syndrome, and it has since then been believed that athletes who participate in sports resulting in repetitive brain injury, such as boxing and American football, are at great risk of this disease. Okay, so now that we know what CTE is, what we want to know is what are the physiological impacts that it can have on the brains of humans and athletes, and how prevalent is CTE in sports where athletes are exposed to these traumatic brain injuries. Development of CTE is centered around something called tau proteins. This is a structural protein present in brain tissue that can accumulate in abnormal ways, ultimately resulting in these findings, in these things we call neurofibrillary tangles, and can ultimately lead to degeneration and damage to the function of brain neurons in the brain tissue. It's the same protein that's implicated with Alzheimer's disease, even though it presents in a different way and in different areas of the brain. There's beliefs that the repetitive trauma to the brain with repeat concussions and head injuries leads to the abnormal accumulation of this protein and ends up causing the manifestation of symptoms that we see as CTE. Here we can see this accumulation. These images are displaying several different regions of the cortical sulci of the brain. These dots that you can see here represent the accumulation of the tau protein throughout these sections of the brain. Furthermore, the severity of this accumulation can impact the severity of the disorder. Thus, a consensus was reached in classifying 4 different stages of CTE, given the severity of the protein accumulation. We can see how the protein pathology in stage 1 is quite discrete, with specific sections showing small amounts of accumulation in specific areas. However, as we progress into the later stages, we can clearly see the pathology become more widespread and present in the frontal, insular, temporal, and even the parietal cortices of the brain. In fact, as we approach the later stages, we can even witness pathology in parts of the brain such as the amygdala, the hippocampus, and even the entorhinal cortex. This is a study which analyzed the brains of 202 deceased football players and notes how the pathology increased, the tau pathology increased and spreads out as the severity of disorder increases. So the important thing here is to see that just how as we progress from stage 1 to 2 to 3 to 4, we start to see more tau pathology in the different sections of the brain and more intensity in these sections of the brain. We'll get to this study more in depth later. So other distinctions that can be seen in the brains of athletes that have suffered from CTE are the deposition of the amyloid beta protein. This protein is the main component of the amyloid plaques found in the brains of people who suffer from Alzheimer's disease. A study by Stein showed that a deposition of this protein was discovered in 50% of CTE subjects, either as diffuse or neurotic plaques. Furthermore, a deposition in CTE occurred at a faster rate and with different dynamics than in a normal aging population, which we can see in the graph to the left. Especially here, where we can see the frequency in amyloid beta plaques in CTE significantly higher in the subjects in their 60s. So what we can see here is a comparison of subjects with Alzheimer's without CTE and subjects with Alzheimer's and CTE, and how the difference in the deposition of the amyloid beta protein can clearly be seen, especially in these range of 61 to 70, where almost double the amyloid deposition of amyloid beta protein is seen in subjects with CTE. And here on the right, we basically just have a visual representation of that. So we're looking at the we're looking at a picture of a patient with Alzheimer's disease, and then on the right we have this a patient with Alzheimer's disease and CTE, and it can clearly be seen the intensity of the amyloid beta deposition in the pictures of the patients with CTE compared to the ones without CTE. Yet another very distinct physiological distinction in CTE-affected brains is the accumulation of the TDP-43 protein. The TDP-43 protein is involved in processing messenger RNA and is originally thought to be a specific marker for ALS. However, it cannot be linked to CTE. A study by Armstrong examined 12 cases of CTE, and in 10 of them found TDP-43 proteinopathy impacting the frontal and temporal cortices, the medial temporal lobe, the basal ganglia, the densencephalon, and the brainstem. In 3 specific cases, there was abundant TDP-43 positive inclusions and neurites in the spinal protein, in addition to tau neurofibrotic changes, motor neuron loss, and corticospinal tract degeneration. These findings suggest that a distinct widespread TDP-43 proteinopathy is linked to CTE, and that in some people, the TDP-43 proteinopathy extends to the spinal cord and manifests clinically as motor neuron disease. This first image shows abundant TDP positive pathology in all cortical layers in the frontal cortex, and as we zoom in, we can clearly distinguish the TDP-43 proteinopathy as indicated by the arrows seen here, along with more instances of this proteinopathy indicated by more arrows. Now that we know what CTE is and how it manifests in the brain, we want to know how prevalent it is in sports. American football is often referred to as controlled violence, where players must advance the ball downfield to score points. It is common practice for players to line up in front of each other and run into each other, clashing heads in order to advance the ball. This causes the athletes to receive multiple strikes to the head every game, almost every play. A study conducted by Mez et al. Shows the results of taking the brains of 202 diseased football players across a range of levels, from high school to college to professional. We can see that 176 out of the 202 players were diagnosed with CTE. However, if we look closely, we can see that as the level of intensity of the sport increased, so did the cases of CTE. Since out of 14 high school players studied, only 3 were diagnosed with CTE, about 21%. Whereas in the players that had participated in the National Football League, so the highest level of professional football on the world, out of the 111 players studied, 110 of them were diagnosed with CTE. That's 99% of the players who played professional football in the United States, 99% had been diagnosed with CTE. Another study conducted by McKee, which studied the brains of 85 athletes across a wide range of sports, showed that out of the 58 athletes who played football, 42 were diagnosed with CTE, and out of these 42, 34 had played in the National Football League. Once again, showing how the level of intensity in football and the level of competition plays a role in impacting CTE. These findings present a very strong correlation between CTE and football players, especially at the professional level. Boxing is a sport where 2 athletes compete against each other to determine who possesses the better skill at damaging the other using punches while simultaneously avoiding the damage of the other. Although boxers do target the body, nearly 77% of punches thrown in boxing matches are aimed at the head. And even the boxers who are known for a higher percentage body shots will only go as far as 40%, resulting in various head strikes and trauma being suffered by these athletes. If we call back to the study by McKee, 10 of the athletes studied have participated in boxing. Of these 10, 9 have been diagnosed with CTE and show signs of previously mentioned physiological impacts in the brain diagnosed with CTE, such as the amyloid beta disposition and the accumulation of the TDP43 protein. All in all, we can clearly conclude that there's a definite risk to participating in inherently dangerous sports such as American football, boxing, and others. Does this mean we should eliminate these sports altogether? That's unknown. More research still needs to be done. It's important to note that CTE can only be diagnosed in an athlete or human um, after they're dead. So it can only be diagnosed through an autopsy. And that makes the research on this topic very difficult and very difficult. But clearly, there is an issue that needs to be addressed. And with that, I will end this presentation and look forward to any questions you guys may have. Thank you.